Hello, everyone. I'm Dr. Gertie Loretta Hurley, the founder and CEO of Taking Effective Action, acronym TEA. Welcome to TEA Sister Voices HIV Chat Series, a roundtable discussion on HIV/AIDS prevention and treatment. Sister Voices is an initiative of TEA, and it is a place where women can find peer support, health education, encouragement, and hope. Our host is Robin Hamilton, an Emmy Award-winning journalist, filmmaker, and writer. Now I'm going to step out of the picture, have a cup of tea, and turn this over to Robin. Here's Robin.
Hello and welcome to Sister Voices, where we're having an HIV chat roundtable where we talk about health to uplift, empower, and educate our community so that we can improve our overall health. I'm your guest host today, Robin Hamilton, and today we are having a conversation about diet and nutrition, and we have an incredible guest, Ms. Sherman Jack Brousseau. She has an incredible resume. She is a registered dietitian and licensed nutritionist who has practiced for over 40 years. She retired from Kaiser Permanente as a consultant, as a health educator. She also works part-time as a nutritionist for Prince George's County Health Department, where she's worked with their Dine and Learn program, as well as the Suburban Maryland Ryan White Part A Administrative Agency. She is committed to reducing and eliminating health disparities. Ms. Brousseau has also worked with the African American Health Initiative in Montgomery County with issues including diabetes, infant mortality, oral cancer, as well as HIV/AIDS. And I also want to mention she was instrumental in the planning of health fairs, educational summit, and small groups with underserved communities. Ms. Brousseau is a charter member and past treasurer for the National Council of Negro Women in the Mitchellville Bowie section. And she is the recipient of the Dorothy I. Height Award in 2001 as well as 2003. She's incredibly impressive. We're so lucky to have her. Let's just jump right into it. Ms. Brousseau, thank you so much for joining us. We've got a lot of ground to cover,
yes,
so we're grateful to have you.
Thank you.
Now, good nutrition is essential for everybody. We know that regardless of what you're dealing with, where you are in your health journey. Some people, it's harder for others if you're dealing with cancer, heart disease, diabetes, and HIV/AIDS. But data shows that a lot of us we're just not eating healthy. And there are a lot of factors that are working against us, especially right here in Prince George's County. I want to mention that the county has some of the highest obesity rates in the state of Maryland. A lot of that is due to poor nutrition and lack of exercise. And it's also important to note that 71% of the food establishments in the county, they're fast food, and that's according to the Maryland National Park and Planning Commission that came out with that study in 2012. So there are a lot of factors that are working against us. It's not easy, it's a lot to do. How can we combat this?
Well, thank you so much, Robin, for asking that question. It's very simple. The first thing we need to do is just increase our fruits and vegetables and decrease our intake of fast foods. We noticed that there's a high consumption of these fast foods restaurants all over in our areas. So we need to start working on increasing fruits and vegetables. As simple as losing 5 to 10% weight can decrease our risk for diabetes, cholesterol, hypertension, and also helps in improving our overall health. We noticed that if we improve our overall health, it builds up our immune system. And building up our immune system also decreases our risk for HIV, AIDS, and other high-risk diseases. So we are concerned right now on improving our overall health by increasing more fruits and vegetables.
Now, that's great advice. It's very hard, and bad foods are tempting. And one of the things that we talked about was, when you're dealing with that temptation, sometimes you go with what's right in front of you. If a grocery store isn't nearby, you just walk to the first thing that's there, and a lot of times that's fast food. So how do we deal with those temptations, especially if you don't even know where to start?
Well, it's one of the easiest methods I always would refer to is trying to get people to do the plate method or trying to get more increase in all the nutrients. If we can eat all the nutrients that's recommended, then we will be doing well. Fast foods, restaurants is going to be always there, but educating the population on healthy eating principles is where we need to go with. The FDA or the FDA or the Food and Drug Administration do have some information on basic healthy food groups. And it's easy right now with all the new technology. We can Google it. We can get information there. One of the things I would always recommend is looking at the food essential nutrients. And the first thing is protein. Why do we need protein? Protein is an essential nutrient. It helps to build and repair our body tissues and help to build up our immune system. So we do need that. We need to be careful about the choices of protein because there's animal protein and there's plant-based protein. So we need to be careful on the type. There's carbohydrates. Carbohydrate is very important because that gives us our energy. But we also have something called simple carbs or sugars. We need to stay away from those sugary products, even though they may give us energy, but it's a risk. We also have fats. Fat is also energy, but where are we getting the fat from? We need to cut back on the high-fat food products, but we do need some extra energy from fat. Vitamins and minerals both help to regulate our body. We need those to keep our immune system going and to build our body tissues. And last but not least, water. People are not drinking enough water, or they add so much things to it. They add powdered package of everything
right.
to the water. But we need to have, that's our taste, but taste what water tastes like, especially for our young people. So we need to look at that. One of the things we can start with is the plate method.
Yeah,
and I had showed you, it is very simple. If you look at this plates method here, it's called my plate. And that my plate means you have ownership. This is my plate. On the plate, the first thing you look at, half of the plate is usually your fruits and vegetables. Now, when we are talking about fruits and vegetables, we recommend more fresh fruits. And I know that we may not always have fresh fruits, but buy fruits that are seasonal. So you look at the season and you buy fruits. Frozen fruits are also acceptable. Vegetables, fresh or frozen, are good. But eating the vegetables and the fruits, we need to make sure that they're different colors. There's a variety in the fruits and vegetables that we eat. On your plate too, if you look at the size of the plate, there's grains. Grains are great because they're the ones that gives you some fiber. And if you need your body to work well, fiber is good. We recommend that using the grains, that half of those grains should be whole grains, not simple grains, not the processed grains. So be mindful. And I want to interject a little bit about looking at the labels. When you look at the labels, the first ingredient, especially for the grain, should be whole wheat or whole grain and not just a simple carbs, sugars. If any product that has sugars as the first ingredient, we need to leave it alone.
This is a lot of information, and it's tremendous information. And this is coming from someone who has made this her career. But for those of us who maybe don't know where to start, this seems overwhelming. Can you take baby steps? And what does it look like? Say you don't want to put a whole plate of fruits and vegetables in front of you. But if you want to start small, what would you recommend?
Well, the baby step is making sure that you meet all those ingredients, all those nutrients. And when we talk about looking at the plate, and it's great for kids, you're looking at the plate, you divide it, use your hand a measurement as a divider. And that's a direct baby step. Okay, so I have half of my plate. It's going to be looking for some fruit. What fruits do you like? You put that on the table. What vegetables do you like? You put it on the table. What protein do you like? And with the protein, I always recommend that, plant-based is good, but if you're going to use animal protein, make sure that it is lean. Make sure when you go to the supermarket, it says grass-fed or free range. and not using products that are really high in fat. If there's no label on it, leave it alone, because you have no idea what's in that product. Keeping it simple is the plate. We eat from a plate. So that's the simplest way we can go, is what we put on that plate that is important.
At the end of the day, why does all of this matter? How does it impact health, especially for anyone who may have a compromised health system, anyone who may be suffering from HIV/AIDS? Why does it matter?
It matters because this helps. If your immune system is good, then it decreases your risk for getting AIDS. It decreases your risk of getting, right now in our pandemic, COVID-19, your research is showing that the better your immune system, you have a higher chance of decreasing those incidences. So it's better for you to increase your intake of high quality foods.
Okay, and what's encouraging is you're saying it's all doable. We can take control of our health. It's possible.
Yes, we can. It's not difficult. We do have a lot of resources that we can go to, and Sister here is one of the resources that you can call and get some more information to. I'm willing to help in any which way possible to people out there who need help with thyroid referral.
Okay, her phone is going to blow up. But that's good. It's good to know that there are options out there, and that there are possibilities, and there are places to go where people can get information.
Like your question about the fast foods, and that's one of the areas we need to work on in reducing our intake of fast foods.
That's right.
We need to have more cooking classes, more grandma showing you how to prepare.
Right?
Yes. We need to know how to prepare healthy food options.
Right.
People feel that cooking takes too long.
That's right. That's right.
So we need to know how to prepare healthier options, and by using, I always go back to simple the plate method. When you go to the supermarket or to the store, think of what you're going to put on that plate.
Yes, and that makes it simple. Well, thank you, Ms. Brousseau. This was so informative, and I want to recap what we just touched on. Again, Prince George's County has some of the highest obesity rates in the state of Maryland, and a lot of that is because of lack of nutrition, poor exercise, and 71% of food establishments here are fast food restaurants, which makes it an even harder barrier to break. But the good news, as Ms. Brousseau just told us, is that there is hope, and there is a way to combat these obstacles that we face. We can eat healthier. You can improve your diet. You just need to find the right resources to support your immune system. And one of those is to use the My Plate method. You can always learn more through resources like sistervoices.org.
We hope you enjoyed today's chat. Be sure to learn more from reliable health information sources and go to sistervoices.org. That's SISTAH voices.org. Then go to the Resources tab in the upper right corner and click on the National Institutes of Health HIV/AIDS Resources link. Get reliable HIV/AIDS information you can trust at hivinfo.nih.gov from the National Institutes of Health. Read, print, or download fact sheets on prevention, treatment, and other topics, like next steps for diagnosis, HIV and diabetes, protecting babies from HIV, HIV in couples, pre-exposure prophylaxis, also known as PrEP, and more. You can also access other health information at sistervoices.org under the HIV/AIDS Resources tab. Click the clinicaltrials.gov link to learn more about studies related to HIV and AIDS or other health topics. You may browse the results or enter other search terms for clinical trials information. Click the medlineplus.gov link from the National Library of Medicine to learn about many health topics, including HIV and AIDS. At medlineplus.gov, you can get fact sheets to learn about diseases, prescriptions, and over-the-counter supplements in medicine. Also learn about genetics and medical tests, and watch surgery videos to understand procedures. Thank you for tuning in to Sister Voices HIV/AIDS Roundtable Chat, where we can talk, share, and learn about topics important to women and our families. Remember to visit sistervoices.org to be sure you're getting accurate health information from sources like the National Institutes of Health. Thank you.